We say health is wealth. Is that really the case in Cameroon? On today's video, I'm going to be talking about our hospitals in Cameroon, how our hospital function, how our health system basically functions in the country. If you like to know more about the health system in Cameroon, if you're trying to move into Cameroon and you don't know how the health system is it going to be okay for you to come here? Are you sure you're going to have any specialists and all that? This is the video for you. If you want to know all that, right? Just keep watching. Hi guys, welcome to my channel. My name is Kenna and I am a Cameroonian content creator. I create content about my beautiful country, Cameroon. If you're looking for information about Cameroon, you want to know more about Cameroon in any aspect, this is your channel for you. I talk everything Cameroon on here. I also do trending topics, but today I am talking about Cameroon. Like I said in my intro, today we're going to be talking about the healthcare in Cameroon. What are the kind of hospitals in Cameroon? So first thing you need to know is our health sector in Cameroon is headed by the Ministry of Health, right? It's headed by the Ministry of Health and it has three parts. It has the central level represented by the central services of the Ministry of Public Health. The central level's functions are the formulation of concepts, policies, strategies, and all that. And then the second is the intermediate level that represents the 10 regional delegations of public health that coordinate health activities in regions. The regional delegations provides technical support to health districts. The next and the last part is the peripheral level, which is represented by the district health services. The health districts are operational units that are in charge of the implementation of health programs. The health service is provided through a decentralized health system, including 10 regional delegations of health, 181 health districts, 2,260 public health facilities, 4 general hospitals, 3 central hospitals, 14 regional hospitals, 164 district hospitals, 155 division medical centers, and 192 integrated health centers. So you would find government hospitals in every region in Cameroon. We have the public hospitals, we have the privately owned hospitals. So for the public hospitals, generally public hospitals are way cheaper than privately owned hospitals because it is for the people, and the government understands that not everybody has money, and these hospitals are really cheap. So consultation goes as cheap as 1,000 to consult to a generalist and as cheap as 3,000 francs to consult to a specialist, right? It just depends on the hospital. Though there are many public hospitals in my country, you see a lot of people avoiding to go to these public hospitals, especially those people who have means to pay money and go to private hospitals. There are so many private hospitals, and private hospitals are also divided into two: those private hospitals owned by the church and those private hospitals owned by private individuals. Talking about private hospitals owned by the church, there are very, very popular private hospitals owned by the church, like the Bingo Annex Hospital owned by the Baptist Mission. We also have hospitals owned by the Catholic Church, like we have something like in Douala, we have the Padre Pio owned by the Catholic Church. So there are some people who prefer to go to these mission hospitals because sometimes people feel like, okay, because they are people from the church, they treat you better. Well, that's how some people look at it. And some people feel like they are more specialized because some of these churches send their pastors, their priests, sisters out of the country to study and come back and specialize in these hospitals. While we have the hospitals owned by private individuals, it could be a doctor, or it could be just somebody who wants to invest in the health sector, a businessman, and then he puts together doctors and he opens a hospital. Generally, the hospitals owned by the church are slightly more expensive than government hospitals. So you see consultation, for example, like I said, in government hospitals, consultation is 1,000. In a hospital owned by a church, consultation could be like 2,000. So the difference is not that big. So people prefer to go there. Another reason why people don't really like going to government hospitals is because they feel like it's always really crowded. Since it's affordable, a lot of people tend to go there. So if you're going to a government hospital, you have to be ready to stand on a long line because there are a lot of people flooding in. That's why some people decide to pick a private hospital. Going to the totally private hospital not owned by the church or the government, these ones can be really, really expensive. An example is the hospital I always go to. Their consultation, normal consultation, goes as high as 10,000 francs, and then for a generalist, and then if you're seeing a specialist, 15,000 francs. Like you can see in Cameroon, there's healthcare for everybody. If you are really, really broke and you don't have any money, you can go to a government hospital. But if you feel like you can afford it, oh yeah, you can go for the expensive hospitals. One thing I noticed about expensive Cameroonian hospitals is that the staff there seems to be nicer. If there's something a lot of Cameroonians will complain to you about, is the fact that sometimes staff in hospitals can be really rude. And sometimes I always look at it like, okay, maybe it's because of the way they pay them, maybe their pay isn't enough, so that's why they tend to be very angry. Because if you're working somewhere and you're not getting paid well, you're definitely going to be grumpy and angry. So I feel like that is it. But when you go to these privately owned hospitals, they're always very polite. Like the hospital I use, they are so polite. I've never met any rude nurse, doctor there, never ever. Everybody's always so polite and so nice. Another thing you need to know about the health system is that in Cameroon we have health insurance. Health insurance is not a big thing in Cameroon because a lot of people do not know how it works. A lot of people do not see the need to do it, right? Just because it's not well established in the country, if I may say so. First of all, I feel like the insurance companies who provide this health insurance are not really doing a good job to put out this health insurance thing out there. I know about health insurance because where my husband works, he has health insurance and it covers his family, his immediate family. That's me and the kids. So we all have our health cards and we go. So this health insurance, it works in two ways. There are certain health insurance that when you have it, you go to the hospital, you pay all your bills with your money, and then you're going to come back with the receipt you apply, and then the health insurance company is going to pay you back. While there are some that you don't use any of your money, you just go, and then you're covered completely. The health insurance cuts it from the company directly. The type I have is the one that you don't have to spend your money before you get paid. And how health insurance works is that it depends on the company you're working in. In some companies, they have 100% health insurance. Some companies have 60%, 75%. Where my husband works, he has 80% health insurance, which means that if I go to consult anywhere, we are going to pay just 20% of the consultation fee. So case in point, where I do my consultation, like I said, consultation there to see a generalist is 10,000 francs. But each time I go there, I pay 2,000 francs. So why would I want to go to a public hospital and stand on the long line when I can go to this other hospital where there are fewer people because it's expensive and I'll pay less money? If I did not have insurance, I definitely would not think like that. But now that I have insurance, I feel like that is more affordable. That is better. It works better for me. So there I can see whatever specialist. And another thing too with public hospitals is sometimes the specialists are not always on ground. So they have particular times that they come and all that. So it's difficult. But with the private hospital, their specialists are always majority of the time on ground. So I know for sure that if I'm going to pay my 3,000 to see a specialist in the hospital I go to, I'm seeing the specialist at the spot. I'm not supposed to wait for a particular time of the month to see the specialist. So that's how insurance works. And I feel like health insurance is something that you should consider getting, because it's not only when you work in a company that you can get health insurance as a Cameroonian. You can also go to this insurance companies and ask them more about what you need to do to get yourself a health insurance. In that way, you know that you're covered when it comes to health. I cannot tell you how much health insurance has helped me. Normally, how the health insurance works as well is that, like, each company has a list of hospitals that they are working with when it comes to the health insurance. So there are only particular hospitals I can go to with the health insurance I'm holding, right? So you pick a hospital, and in some hospitals, like for us, government hospitals, I have 100% coverage. I forgot to say that. Government hospitals, I have 100% coverage, which means if I go there, I don't need to pay anything. I don't need to pay consultation fee. I don't need to pay for drugs. If I stay in a government hospital 10 days, 50 days, 100 days, I am not paying anything. I just go there, they treat me, and I come back. But I would still prefer to go to a private hospital because I feel like since it's expensive, there are fewer people who come there, right? But government hospitals, there are so many people. Yes, you'll not pay anything, but you're going to spend a lot of time waiting. Those are the things I look at, because on the list of hospitals that we have insurance in, we have certain hospitals, all the government hospitals, we have 100% coverage, and then private hospitals hospitals we have 80% coverage, and though you have 80% coverage, you have like limits. For example, when I wanted to have a baby, there was a limit you are not supposed to exceed. For example, when it comes to the limit, they'll tell you things like, okay, as somebody with 80% coverage in this hospital, you don't have to take a room that is more than 20,000 francs. So if the hospital has rooms that are 30,000 francs and you prefer a room for 30,000 francs, no problem, you can always go and use a room for 30,000 francs, but you also know that the extra 10,000 francs on that room for 30,000 francs, you're the one to pay. Anyway, guys, that's it for healthcare in Cameroon. A lot of people will tell you that healthcare is not the best because you see people dying because of the slightest of small health mistakes and all that. So when I look at all of these things, I'm like, okay, maybe going to a private hospital is best for me because one, the doctor has less stress, less amount of people to take care of, so he's concentrating on me and looking just at me to ensure that I am fine. In that way, I'm going to a hospital and I know that I'm good. This doctor is not thinking of the other 500 patients he has to take care of. Majority of the time when I go to my hospital, I've never gone to my hospital and there are more than 10 people in the room waiting to be consulted. But when you go to government hospitals, oh my God, you have like 20, 50 people. If you want to see the doctor fast, you have to get up by 5 a.m., 6 a.m. and you're going to the hospital. And for me, that's just, it doesn't work for me. So that is it. This is what you need to know about hospitals in Cameroon. What do you think about the health system? For me, I feel like the health system in Cameroon is not the best and I feel we can do better. Thank you guys very much for watching this video. Let me know what you think in the comment section and I am going to see you on my next one. Love you guys. Bye.